More minorities than ever are going under the knife in their quest for their vision of beauty. But is ethnic plastic surgery really a way to cosmetically erase race? Take a look at these before and after pictures of minority patients. Doctors say African Americans often seek to narrow their noses. Asians routinely request eyelid surgery. New at 5, Kelly Avellino investigated this growing trend of ethnic plastic surgery.
Surgeons and patients say that their procedures are about looking their most attractive while still preserving their ethnic characteristics. But some critics argue that an African American sharpening their nose or an Asian person opting to have their eyes appear more open is in itself masking ethnicity.
Modern supermodels may be different colors, but do they commonly display Western beauty ideals? A slender build, big eyes, petite noses.
Yeah, I think overall your tone and texture and everything looks really good.
Richmond Dr. Travis Shaw specializes in ethnic plastic surgery. Dr. Shaw says his patients ask to look their best, not to look white.
We're not trying to go for this one homogeneous idea of beauty that should apply to everyone in all races and all ethnicities.
Dr. Shaw tells me the goal for both minority and Caucasian patients is the same, subtle improvement.
How can we better make small changes and refinements to attain balance?
The number of minorities going under the knife has skyrocketed over the last decade, doubling since 2005, according to the American Society of Plastic Surgeons.
It's definitely worth it.
Dr. Shaw points out ethnic plastic surgery is also about fine-tuning procedures to fit different needs. Anthony Graham is of mixed race. He got laser resurfacing to his face to improve scars left from shaving.
The hair on African American skin tends to curl back in and cause ingrown hairs, and then from that you get little pit marks.
Dr. Shaw tailors his laser to treat Anthony's face, since darker skin is more at risk for hyperpigmentation.
Seeing that plastic surgery is becoming bigger and more accepted among everybody, I think there's a spike in other ethnicities getting work done.
Sarah Javier is working towards her doctorate degree of psychology at VCU. She conducted a study on self-image among minorities.
I feel like you have to have a reference point for doing this kind of plastic surgery, and where are these ethnic minority women getting that reference point from? Because you see a lot of underrepresentation in the media.
Despite the debate, ethnic patients will continue their journey for attractiveness, much like anyone else.
I think if you want to fix something that you're insecure about, I think if it's going to make you feel more confident, I think you should do whatever makes you happy.
Another interesting find in Sarah Javier's study, a person's body image is greatly influenced by how their friends and parents view themselves. I'm Kelly Avellino for NBC12 News.
Accurate, reliable.